I am really happy that you could join us today in this hot weather to talk a little about your topic that you will present at the conference in September, which is about fascia. So, hello.
Hello, Petra. I'm very glad to be here with you and to talk a bit about that subject of fashion. It's a very interesting topic indeed.
And you are kind of an expert in fascia. And you are also an osteopath, so you have lots of interesting things to share with us. And I would say that in last couple of years, fascia has become a little bit more interesting to people, is getting more attention. And what would be your experience in connection to well-being of dogs?
Yes, you're right that in the last years is getting more attention because before was just that tissue that was removed in dissections by anatomists and threw it away because they were focused more on muscles and bones, all those structures that were under the fascia. And perhaps that was because they didn't know the function of the tissue or components or anything apart from that was there wrapping or giving a structure to the body. And in the last years, experts and some researchers have found not only types of fascia, but also information very valuable about components. And the most important aspect are the functions of the fascia. And in my experience, well, I found the fascia by accident, let's say, when I started to study dog training. And then in one of the first programs, there was a point about the Tellington T-Touch method to work with the behavioral problems. And at that moment, I was with my adopted dog, Klaus, who was very anxious and stressed. And what I knew was that he had a lot of tension in his body. And then when I read that, I thought, wow, that could be a very interesting way to approach the treatment or the programs, or the educational programs that I was already practicing with him and learning. And then after practice, really, for the very first touches, his behavior changed, but immediately almost. And the way that he started to interact with other dogs was what the most incredible thing that I saw. I almost cried the first time that I saw him, and the different thing that I was doing was touching the superficial fascia. I didn't know at that moment I was moving just the skin. And that was my experience with that first dog. And then with other dogs that I have worked, I always use those touches and techniques. And then I studied, of course, yes, as you said, osteopathy and massage and myotherapy with Galen, of course. And this is what I'm doing. I'm combining the hands-on therapies with education for the families, for communication and changes in style of life. But for me, body, physical part of the dog and the psychological part are impossible to separate. So are totally connected. And perhaps that connection is fascia. That could be the bridge that we know now that is real. And that was my beginning, knowing more about fascia. And thanks to your offer to speak in the conference, I did my own research, and it's really super interesting.
So you were mentioning that till a couple of years ago, the specialists or the vets paid more attention to muscles and bones and didn't know the function of fascia. What would you say, just in very short and plain words, what the function of fascia is?
Well, fascia is a connective tissue. This is what we knew before. But now we know that it's a continuous web throughout the body. So it's more than just a connective tissue. It's a living tissue dynamic that is covering all the body. That means that we have the superficial fascia under the skin, and we have the deep fascia covering muscles, but also muscle fibers, bones, and tendons, and all the structures. And it's covering as well the blood vessels and lymphatic vessels. And the visceral fascia is covering as well organs in the body. So it's continuous. There is no beginning and no end. And some experts say that it's like the internet in the body because it's a communication web. And this is part of the functions of the fascia that we know now. And before it was a mystery, or just was nothing important to pay attention to. So it's about the functions. It gives a structure and keeps everything in position in the body, but it's also giving coordination and possibility of movement, or that flexibility in movement, because we are not machines, and that movement is allowed by fascia. That flexibility in all the group of muscles is giving that, and it's like a mechanical function. But as I was saying, the communication part of the fascia is very important, because molecules in the body are sending messages to the brain. It's innervated tissue, and is considered as well as a sensory organ. And not only that, it's like the organ of proprioception. So is the whole body is giving information about perception and the position of the body in the space, which is basic for survival, for safety of the dog and the human beings as well, no? all the animals. So functions are very very important, are essential really for life.
So if it's so important, first of all, can we damage fascia? If it's just some connective soft tissue, can it be damaged? And what can we do to keep it healthy and working and functioning?
Yeah, yes, of course. There is a lot of things that we can do. First of all, fascia can be damaged by many factors. Probably the main one is movement, and is the lack of movement on one side. So this is the most important aspect. But also too much movement can damage the fascia, or repetitive movement. So the main aspect here is movement. But there are also other factors. For example, because of the composition of the fascia and that possibility of communication of the cells, there are inflammatory cells and receptors in the tissue, in the fascia. Chronic stress can damage fascia. All the molecules in stress, all the inflammation that is related to stress can damage the communication in the tissue. Of course, surgery or injuries can damage the fascia. And nutrition, poor nutrition even, can damage the fascia, or the hydration as well. So it's because of those functions that it has. When something interrupts or disrupts that function, the fascia is damaged. And on the other side, what can we do to keep it healthy? Well, first of all, movement, then proper movement with for senior dogs or in fact any kind of dog at any stage of their lives and need movement, functional movement, natural movement, not walking the same surfaces all the time, like really be able to explore all range of movements, and they combine more active, some other times less, as I said, surfaces, different requirements in movement. Also for dogs that do exercise or training very often, it's very important that they have a proper rest. Lack of resting is another aspect that can damage the fascia. So it's to recover the tissue and to resolve any damage or micro damage that is done during normal life. It's necessary to recover and to sleep well and to, but good nutrition and being relaxed and calm. Now, controlling stress is very important. And of course, one of the main tools that we have is manual therapy. This is also very important because it's also movement, but assisted movement. Instrumental or manual, but yes, therapies can improve the health of the fascia. Yeah.
I love it so much that you are mentioning so many times the movement and that you have put the movement in the center of importance for healthy fascia,
Yes.
because the whole conference is about basically about movement and yes, also pain and behavior,
Mhm.
but the
Yes.
movement is the central topic of it. And especially mentioning the older dogs. I love it also so much that you have mentioned older dogs because so many older dogs lack movement. I understand, I really understand vets, veterinaries when they say you should watch your dog, don't let him, run like he used to and jump because he can hurt himself. I understand all of that, but
Mhm.
if you create like a frame in which the dog can move, then if the dog can move freely and for as much as he wants or doesn't want, I think that's the best.
Yes.
Another question that I would have, because you were mentioning all the how we can damage fascia, um, and that it also lack of movement or too much movement, especially forced movement, can hurt it. Does this create pain in a dog?
Yes, and this is something that is known and nowadays because part of the information that we have about fascia is that it's highly innervated and it has nociceptors. So it has receptors for pain. When the fascia is healthy and the movement is flexible, all signals sent to the brain from the body are just fine. It's good feelings. But when the fascia is damaged, then the signal that is going the tissue is pain. And yes, there are different kind of damages, but when that lack of movement can create that densification in the tissue, that means that the layers of fascia should move, glide in the extracellular matters. The hyaluronum is one of the components that makes flexible and mobile the fascia. And when it's damaged, that and there is no movement, you lose. It's like a river is stopped, then it becomes thicker and viscous. The composition of the tissue changes, and that creates discomfort. And what is known as well about fascia is that that pain can be, or most of the times, is diffuse. It means that it's not located. So that makes very difficult when you go with the vet and you feel like the dog is uncomfortable in discomfort, or perhaps it's having pain, and but pain is not there because it cannot be seen, because it's very diffuse, and it's not in one location. So it's not when you touch, but it's the feeling, or the way that humans describe it is like general discomfort. So it hurts. You don't know where exactly. So just imagine in dogs, they cannot say that. They just feel that they are uncomfortable and not feeling well, or feeling pain, in fact. And there is, so when there is another kind of damage, we are talking like a surgery or injuries, then it's different. It can be fibrosis, and that is the collagen, the fibers are disorganized, like doing scars inside or below the skin. And that can even trap a nerve, and that is also creating pain. So yes, fascia hurts in different ways, but yes.
So if somebody has a dog that shows signs of discomfort or pain, and they have been to the vet, they have been to specialists, and they said, with your dog, everything is okay. I mean, all the joints are okay. Uh, he has the range of movements as he should, or at least similar, but still the guardian sees that something is not okay with the dog, and maybe now listening to you thinks that maybe could be fascia. What do you do then?
Yeah, well, it's palpable. I mean, what you can notice, this is something that therapists usually say, that you can you can place your hands on the body and you notice that it's not moving freely. But you have to look at that, not only the joints or the range of movement of the joints, but also different parts in the body. It's in dogs and as well as in humans, thoracolumbar fascia is like, well, Carla Esteco is one of the experts in the field, and she says that in that part there is like a huge receptor, because transmission of forces from everywhere go there. And it happens also in dogs. You were talking about senior dogs. We see that that part in dogs are usually, senior dogs, more rigid, that you can notice it when you touch it, and that hurts. But in time, that densification and that lack of movement of the fascia is creating compensations in other places in the body. So perhaps you are looking at the wrong place. That happens very often, that you are looking at the limping, but it's coming from another part in the body, because the dog was trying so hard to avoid that discomfort, then it's hurting those other parts that is compensating. Yes. It's,
So, how can I help my dog that has problems like this? What can I do?
I think observation is the to prevent is the first thing you can do. And this is something well, we as professionals should educate caregivers and other colleagues, because fascia can be damaged, because this lack of movement, or this discomfort, subtle discomfort, and and then at that moment is it can be recovered with therapy, with proper movement, with applying changes in the style of life. But if you don't do anything, then the problem is getting bigger. And then when it can become fibrotic tissue, and then it's more difficult to treat because there are some other cellular changes inside, and it takes more time, and then the problem is bigger also in organs and in different aspects, even in behavior, if you wait too much. So first of all, if is being able to recognize that there is a problem, and most of the times is touching the dog and feeling him, and how the tissue is moving, how the dog is walking, running, and yeah, it's I always observe dogs, and a lot of them have alterations in movement, and most of people don't know, don't realize. And I'm not saying there are bad postures, bad habits that can be changed. Sometimes the equipment that they are having every day is creating that discomfort and that dysfunction of the fascia. So this is what I think everybody should do, or being aware as soon as possible that it can be a problem.
Yeah, I agree with you. And I have to say that talking to already Julia Robertson and also Beate, who will be at the conference speaking at besides you, they have also gone in this direction, that the observation and realizing that something is not okay with your dog is the most important. And then, of course, that professionals like veterinarians or dog trainers could also recognize, can help. And then myotherapists, different kinds of therapists should listen more to the guardian of the dog, because the guardians know their dogs. And if they say, my dog is not feeling well, or he's behaving weird or differently, then this means something is wrong. So you have to observe, and then you have to feel the dog.
Yes.
So I think we have said enough. We have to leave something for the conference.
Yes, yes.
Although it was very interesting, and I would still have more and more and more questions, but
Yeah.
we will discover more in September. So
Yes. I will bring new information and new things.
thank you very much, Sharon, for joining me
Thanks to
today
you. It's been a
and for
pleasure.
sharing information, and see you in September.
Yes, very soon. See you.